Good evening. Today I will be discussing the muscles of respiration, beginning with the muscles of inspiration. First, I have our diaphragm, and our diaphragm is responsible for depressing the central tendon in the diaphragm, enlarging the vertical dimension of the thorax, and distending the abdomen. The external intercostal function is to elevate our ribs. Inner intercostal or interchondral portion is known to elevate ribs 2 through 12. Levator's costarum brevis and longus both elevate our rib cage. Serratus posterior superior elevates ribs 2 through 5. Then we have our sternocleidomastoid dimastoid or superficial neck, and its function is to elevate the sternum and our rib cage. Then we have scalus anterior and medius, and what both of those do are elevate our rib 1. Then we have scalus posterior, and in scalus posterior, it elevates rib 2. Now I'm going to discuss pectoralis major, which its function is to elevate the sternum and increase the transverse dimension of our rib cage. And pectoralis minor is also responsible for increasing the dimension of our rib cage. Serratus anterior elevates our ribs 1 through 9. Subclevis elevates rib 1. Levator scapula is responsible for supporting our neck and elevating the scapula. Rhomboideus major and minor both stabilize our shoulder girdle. And lastly, for inspiration, we have trapezius, which elongates our neck and it controls our head. At this time, I'm going to discuss the muscles of expiration. So in the muscles of expiration, we have internal intercostal, which it depresses our ribs 1 through 11. Transversus thoracis depresses our rib cage. Subcostal is responsible for depressing the thorax. Serratus posterior inferior, it uses contractions, and with the contractions, the rib cage pulls down and it helps support the expository efforts that are being made. The innermost intercostal is responsible for depressing ribs 1 through 11. Latissimus dorsi helps decrease the circumference of our trunk. The transversus abdominis, it compresses our abdomen. Internal oblique abdominis, it rotates the trunk, flexes the trunk, and it compresses our abdomen as well. External oblique abdominis, its function is to use bilateral contractions to flex the vertebral column and compress the abdomen. But if it's unilateral contractions, then it's going to have the trunk rotate. Then we have rectus abdominis, which is when there's a flexion of the vertebral column. And lastly, for muscles of expiration, we have contractus lumbarum, which it uses bilateral contractions as well, but it fixes our abdominal wall to help support abdominal compression.